I'm Dr. Doolittle, and I'm going to show you the lymphatic circuit that I've been using with my patients to help get the lymph system moving and flowing to carry out those toxins. So we know that the lymphatic channels go throughout the entire body, and they're always carrying through these little lymph nodes, all the things that are going to the thymus, and then helps to filter it out of the body. The toxins actually do filter out of the body through 3 different methods. They're either through sweat, we get it out through urination, or through defecation, having bowel movements. So we've got to make sure that all of that's functioning well prior to lymphatic circuit and prior to the lymphatic therapy that we do. However, we also have techniques to get the bowels moving if that's an issue already. We use percussion with the soft tissue mobilization in a specific movement pattern that helps with the valves and helps with the colon to get things flowing like it needs to, and also for interior nervous system stimulation. So now what we do with the lymphatic circuit is we go ahead and start them on a vibration plate, and this specific vibration plate is one that oscillates. The reason why is because we want that good motion, that shaking, that superior and lateral motion, and that's really going to help those muscle fibers and the fascial lines to really just break up some of those toxins that lie in under it, because we know that the fascia sits pretty tightly right onto the muscle, and we have to create that shearing motion just to get that to start draining. So that's already going to start increasing healthy lymphatics. That's one of the reasons why rebounder works. However, rebounder I don't suggest for people that have any joint issues. That's one of those, the rebounder is like one of those small little trampolines that you just sit there and bounce on. It's not great for the joint issues that people may have because it's kind of jamming. So that's why we go for the vibration. Then what we do is we do a chi machine, which shakes in a horizontal, like in this plane across, and that's going to really help along that coronal plane to really break up some more of those toxins, some of the fibers that laterally might be holding the toxins in. So we now have the superior and inferior shaking, and then we've got this lateral shaking. That's all so important to really just get those toxins all kick-started and kicked up into the system. So then what we need to do is we need to open up the lymph nodes. We need to open up the lymphatic channels. So we love using this specific percussor from Arconia, and this is because this percussor has not only vibration, but it also oscillates. So what that oscillation does is that really helps with the soft tissue. We're very gentle with the lymph nodes, but as you can see, it just very, very gently will move the tissue, and we work all the way up the channels. So our amazing therapist has already learned exactly where the primary lymph nodes are in these lymph channels, and she'll be helping to move those lymphatic channels to carry the toxins up. And we want to carry them towards the thymus, which is right here along this chest area. We go especially in the regions of any lymph nodes, if there are any swollen lymph nodes that patients have, any cervical lymph nodes that are chronically swollen. We're very careful. We always make sure that we've done the check and the exam to make sure that it's time to move it, but we really get those lymphatic channels open, and there are a lot of areas right around our cervical region that gets those lymph nodes opened up and really moving out. Also, if somebody has had tattoos done, then we know that's a lot of heavy metals from that specific ink that lasts in a lifetime. So we really like to have patients that have them done, then we get that lymphatic channels, especially in that region wherever the tattoo is, and especially proximal to the tattoo region, to really make sure it's clearing it out. And all this time that the patient has been sitting in here getting the therapy, they're also under this light, which is a far, near, and mid-infrared light. And this infrared light, the far will go 6 inches deep to the tissues of the skin, and it will actually help to break up fat. It also will stimulate bone, good healthy bone growth information, so it's great for joint tissues. And then we have the mid that also is great for the soft tissue, ligament support, tendons, tightening and toning, and also for the lymphatics, it's going to help with the detoxification. And then the near infrared is great for the fine lines, for wrinkles. It really helps with that beautification portion and just the tonicity of the skin and the health of the skin. So then what we do is we know the cavitation and the radio frequencies ultrasound machine, that's something that I already adjusted in another video for all the weight loss and the great cellulite therapy and all those other things for skin tightening that we like to do. That can be paired with it, along with the lymphatic circuit that we're already doing to help carry out the toxins, because that's one of the biggest portions of the weight loss, that we make sure those toxins get out so that they don't keep on going right back into the adipose, and that just creates the chronic, on a diet, and it's just the rubber band diet syndrome, as like we say. And then what we do is we have the patient rest over here on the femur mat, and they have their feet in it's a negative hydrogen ion foot bath that's really going to help with polarizing the toxins. So this is what helps your body to conjugate the toxins, pair them, get it out, filter it out through the kidneys, through the liver, whatever the processing needs to be for whichever type of toxin it is. And we'll see the water change in colors, which is not the toxins coming out into the water. I always like to specify and clarify with my patients. Don't look at the water and say, oh my gosh, what toxins have come out of the bottom of my feet. No, actually what that is it's actually how the chemical processing of the anode is reacting with the water and impurities in the water. But then what happens is we know that it's about the polarizing effect that happens in the body. You'll actually feel a lot of great energy from this. Most patients feel like they sleep much better for days, weeks after. We usually try to make sure that they do come back in if they're very toxic, have a lot of toxic overload, a lot of lymphatic issues, and their channels are not very well open. Then we'd like to say at least once a week for about a month, and then we can move it out from there, maybe every other week, maybe once a month, depending on how well they're detoxing. And after that, once they go on maintenance care, then it's really good to also just, make sure that they come in every 3 months or so to get a little checkup, get their lymphatics cleared, and it's just better to not have the toxins build up, to just make sure that the lymphatic system is doing what it should do. This is always, of course, paired with blood work and the healthy, good functional nutrition and the functional medicine aspects, and so that needs to be taken care of as well for the detoxification. But so far we've got a really great synergistic effect of this little circuit that we paired. So glad to present it to you, and I'm excited for you to try it.